Hello, I am Sam Cobbs, CEO of Tipping Point Community. This is the first of what we hope will be a series of unscripted conversations about critical issues in our community. Thank you for joining us today. As the film that you just watched mentioned, our vision at Tipping Point is that one day, everyone in the Bay Area has the opportunity to prosper. We do that by building community. That's all of you. Investing in the best organizations on the front lines and working with policymakers in the fight against poverty. Education has been and always will be a critical component of that work. We know that earning a college degree is one of the best ways to break the cycle of poverty. We also know that the pathway to a college degree starts early in a young person's life. Today, we're talking about education in the time of COVID. There might not be a hotter topic right now. As proof, we have over 500 people who are registered to be a part of this conversation today. And while there is much debate about how best to serve our students during this time, I'd like to begin with a few things that I think we all can agree on. First, many of the challenges that COVID is shining a light on existed before the pandemic. We might see them more clearly now, but issues like disparities between low-income kids and their more affluent peers have always been there. It's not new. Second, we, and I'm speaking for the general public, as well as the head of a philanthropic organization, we put a lot of pressure on our public officials, especially those who are entrusted with educating our kids. It is our responsibility to hold you accountable. And this is important, it is also our responsibility to support you by appreciating the complexity of the work that you're undertaking. One of my favorite quotes is, "Before you can hold someone accountable, you must first hold them." Over the next hour, we're going to talk to three experts, decision makers, who are wrestling with the impact of COVID every day. Or, in the words of the poetry ensemble Outcasts, they're wrestling with COVID all day, every day. If you have a question, please use the instructions on the screen, and I'll do my best to weave them in. And for those of you who sent in questions early, we will do our best to get to many of those. Before I introduce my guests, I would like to thank the principal and staff of McClymonds High School for hosting us in this beautiful library. And I would like to note that we're following all of the health protocols that have been put in place by the state and local health officials. Today, I'm joined by Oakland Mayor Libby Schaaf. I call her my mayor, even though I don't live in Oakland. San Francisco Unified School District Superintendent, Dr. Vincent Matthews, who I learned during our prep conversation that both Dr. Matthews and I have spent a considerable amount of time on McClymonds campus during our career. Welcome home, Dr. Matthews. And Dr. Naomi Bardach, Associate Professor of Pediatrics and Health Policy at UCSF and State Safe Schools for All Team Lead at California Health and Human Services Agency. Dr. Bardach, you win the award for longest title. Thank you for joining us. Once again, welcome. Let's start by getting a lay of the land. As I said in my introduction, the disparities by income, race, geography for low-income kids is nothing new. It existed previous to the pandemic. So Dr. Matthews, can you start us off by speaking to the state of public education before the pandemic, before the crisis? And I should mention that we received many questions about inequity in education from the viewers who are here today.
Thank you. Thank you for that question. So first and foremost, let me thank you and thank the viewers who are watching this important topic. I appreciate you joining us. Um, so you asked about what's the state, and let me start with our mission. Our mission in the San Francisco Unified School District is that for each and every student, we provide quality instruction and equitable support so that they can thrive in the 21st century. And for me, what's key about that phrase is the each and the every. And so that means we as a district have a responsibility of looking at each and every student. So when you ask about the state of education, it really is mixed, because for some of our students, when you look at data, whether that be academic data, suspension rate data, attendance data, you see that for some of those students, we're really able to fully engage and fully activate all that we want to and need to in those students. And others, we're not able to. So there really is, as you just alluded to and talked about, there is an opportunity gap. And for us, it's really looking at that each and every and making sure that we're doing everything in our power to raise those levels, especially for students who we haven't been successful with, who we haven't engaged, who we haven't been able to assist in reaching their full potential. It really is a mixed state right now.
Thank you, Dr. Matt. Mayor, if I can ask you to also comment on one of the things I'm particularly interested in is I was on a call earlier today, and we talked about proximate leaders, meaning that people who are close to the problem. And I know one of the things that people have talked about as one of the cures to our public education system is more teachers who are from the community. And in the Bay Area, it is hard to be a teacher here. We have the highest we have the highest rate of rent and what it costs to live here. And I know you have started a very interesting program around housing and teachers. Can you talk to us a little bit about that?
Absolutely. And let's be clear, an equity agenda benefits everyone. Our kids cannot learn to their fullest potential if they don't see themselves in their teaching staff. Study after study shows that, documents that. And in Oakland, not only do we need more teachers that are high quality in these hard to recruit subjects like STEM and special ed, but we need them to look like our students and share some of their life experiences. And we know that a big blockage to that is the high cost of living in Oakland. And we want our educators to actually live in the communities where they're teaching. So in Oakland, just huge shout out to some of our founding partners, Lisa Stone-Pritzker, just an amazing philanthropist. We have an anonymous donor, and just this community is so full of generosity and innovation. And we are not waiting to build teacher housing. There's lots of talk about that. We've actually identified an existing project where the landlord was willing to discount for teachers. We were able to secure a 30% commitment from our resident teachers. These are hand-selected teachers that are in a special training program that we know produces excellence in teaching. And then we've raised from philanthropy the difference. And so by everybody putting in a little bit, we are providing an amazing, affordable community for teachers of color in these hard to hire subjects to actually get that incredible year of residency done. And then we continue to give them a guaranteed income for the next 5 years if they remain teaching in Oakland. We believe this is going to turn around the retention problem, the equity problem, and really elevate the quality of education for our kids. So excited about this because we know that inequity was true before COVID. It is even worse right now.
Thank you, Mayor, for that. And we've been proud to partner with you, not on that particular project, but on Keep Oakland Housed, especially during the pandemic, where we have provided rental assistance, eviction prevention dollars to the region. The pandemic, one of the words that we didn't talk a lot about, or you didn't hear a lot about previous to the pandemic, was this word called pivot. And right now, everybody is pivoting, right? We've all had to pivot to something. And so the pandemic has forced us to respond in new ways. Here's a question from a Tipping Point grantee about what it is that they're seeing.
Hello, my name is Erica Waterford Stowers from First Place for Youth. My question for the panel today is, what are the best practices we're seeing to address the digital divide that COVID has really highlighted for marginalized populations?
So that question was really around what are the best practices and what has been highlighted and what is working well during COVID. Hopefully people at home could hear that. We couldn't actually hear that here in the studio, but I am, now that I've reframed the question for the mayor, would you lead us off in talking about the work that you're doing in this place?
Absolutely. This is one of my absolute passions. And, I want to remind everyone, none of us has a global pandemic department in our agencies. However, I know that we are all pushing, particularly our public servants, to not only respond to the crisis, but I keep on calling it like silver lining city. What are some opportunities that this crisis is giving us that we wouldn't otherwise have? And closing the digital divide for good is one of them. In Oakland, our Oakland Undivided campaign has been one of kind of my greatest joys during what has otherwise been a really difficult time. We have to recognize that we can't just lend out devices. We actually have to give devices to families because these are not just for students. This is a lifeline for the entire family, and that includes the parents. And we will never have a moment where families that have not felt engaged with digital literacy have more motivation to become digitally literate. And I've got to give my hats off to Tech Exchange in Oakland, one of our trusted nonprofit partners. To have a culturally competent, community-based organization that knows how to give tech support to first-time users of technology in their language, at their homes, in a healthy and safe way, that is part of the secret sauce of Oakland Undivided. And so in a very short amount of time, and huge thanks to Jack Dorsey, who gave a transformational $10 million contribution to our efforts. Unlike the national average, where only 70% of kids have digital learning, distance learning tools right now, in Oakland, we have 97% of our children with a device that they own in their home, with an internet connection, and with this culturally competent technology support. And we are building this to last, not just to be here during COVID, because this is a one-time opportunity to actually close that digital divide for good, not just put a Band-Aid on it.
And Dr. Matthews, we all know that, in-person learning is definitely the best. But dealing with this pandemic, we've had to pivot to digital learning. And I know that there's some very innovative things that the San Francisco Unified School District is doing as well. And I'll also mention prior, as we were sitting here in the library, one of the things that Dr. Matthews reminded me of is that when we first began to think about this virus, like no one ever thought we'd be here talking about it a year later, almost a year later. I think about something a comedian said, and he said, he thought the virus was going to be just like everything else that happens in America, that we were going to take about a month and we were going to kick its butt and then everything was going to be back to normal. And we didn't expect to be here. And so you've had to innovate and do some things to make sure that digital learning and that the fall behind of kids isn't as strong as we are seeing in other parts of the country. Can you talk a little bit about your efforts there?
Yeah, absolutely. And this is, as Mayor Schaaf was saying, this is something that we're really excited about. We have, in going in, we've known, this is one of the things I've said forever, basically, is that we've known what that skill is, but have we had the will to actually do something about it? So we've known that there has been this digital divide. We've known that it's there, it's out there. We've known that a certain population of our students have had devices and others haven't. So immediately, even before when we had the inklings that this is where we were headed, we started gathering devices and started raising the funds that was going to be necessary to make sure that each and every one of our students had a device in their hand and that they also had the technology to make sure that the connection was there. So every one of the students in San Francisco, 100%, all have devices. If any student who wants one, we had some students during the fall who have come back because the device either broke or is no longer working. They got a new device. And then we also have the connections. So students who needed a hotspot to get connected, they all have hotspots, and we as a district are providing that. We have some very generous donations. The Sarah and Williams Foundation gave us $10 million to assist us in making this happen, but we have donors throughout the Bay Area, throughout the world, basically, who have said, we want to be a part of this. One of the others, though, that I wanted to mention, we talked about the things that we have learned from this pandemic. Another area where we have said we know that we can do a better job, we know that, once again, the skill versus the will, is our ability to check in on families, how they're doing wellness checks. We now do that for 100% of our families. We're calling them, we're checking on them. We set up the opportunity to meet those needs. And we've also been able to, if we could meet the need, we can give you the resources to get to an area that is assisting people in meeting their needs. We as a district have looked at the needs, we've analyzed the needs, we've asked people what your needs are, because we know there's a gap now. We look at it as we're apart, but we're still together. We're apart, but we're still a family. And we have to do everything we can to make sure that we are, as you've said, pivoting so that we are meeting the needs of our students, so that, as I said earlier in our mission, that we're making sure that they're going to receive a quality instruction and the support that they need so that they can thrive in this century.
Thank you. Now, I'm going to pivot again to a little bit of a different part of the conversation. And so there is one question that we have gotten that is probably 3 times as many times the questions that we've gotten about other topics, and that is around how do we think about the future of schools, and more to the point, like, how do we think about opening up safely for a lot of different reasons. And so for that, I'm going to actually go back to the video. And there's a question that we've received from a 13-year-old Alameda County student. And so if we can go to the video and tee that up, I would like Dr. Bardach to answer that question after we come back from the video.
Okay. In the fall, I made the really hard choice to transfer out of public school and go to an in-person school. I miss my friends and I really want to go back to public school. I want to know what we have to do as a community to make that happen.
Great question. Thank you for joining us, Dr. Bardach. Could you please respond?
Yes, my pleasure. And thank you for bringing that voice in. It's so compelling to hear from a student in these fora, because I give these talks often, and I feel like it's so important that we hear directly from the kids. So there's a couple different things. We need to commit as a community, as a society, to place a very high value on education. And the CDC just came out a couple weeks ago with a study that showed that there wasn't an association with having schools being open and higher rates of COVID-19 in children. The end of that article said schools should be the last to close and the first to open in the pandemic. And that's a value that has been reflected in other countries, and I think is where we are beginning to really move right now, as a nation, and also as a state, and I think locally as well in San Francisco, the Bay Area. And I think it's really important we continue to move in that direction. And there's a couple of things we need to do. Our rates are going to go up and down. We just came out of one of the worst surge of the pandemic so far. We know from July, when the first surge happened, or the second surge, that we didn't keep planning during the July period to have our schools reopen. We sort of were so focused on the surge that we didn't anticipate the fact that the rates were going to go down, and so we weren't actually really ready to open in the fall, in September and October. So one really important piece is that we have to keep planning as so that when the rates are going down, that then we're ready for when it's safer when the community rates are lower. So that's one piece. The other piece is we have to commit as a society to the resources that are needed for schools to be able to open safely. So we know that those mitigation strategies are extraordinarily important: masking, physical distancing, good ventilation, hand hygiene, symptom screening, and testing, particularly in response to people who are symptomatic, and then some asymptomatic testing potentially as well. So in order to have those resources, we have to commit to making sure that the schools have them in order to do those safety mitigation layers. And, you know, public education is historically underfunded. So I think that that, to me, is a crucial piece. And I know that from my position at the state right now, there is an understanding that those resources are extraordinarily important. So there's a plan right now to not only do monetary resources, but also technical assistance resources, because it's complicated to get that sort of thing going, and to do all those mitigation strategies. And then the last piece is a transparency piece, so that we better understand what are the case rates in our schools. How do we reassure ourselves as we move forward that things are safe in the way that we think they are going to be safe based on other experiences nationally, internationally, that as long as those mitigation layers are in place, we can have safe schools. We're going to have some transparency to see that. So it's multiple different pieces, but I think as a society, what do we have to do as a society? We have to commit to those resources and keep those school communities safe. They need to be safe workplaces for the teachers and safe learning environments for the students. And then the last piece I would say is that as we go into lower case rates, which, you know, it's really so helpful to see those numbers coming down. Like, I am so deeply grateful to see those numbers coming down. As we go in and we are beginning to open up our society a little bit more, instead of people generally feeling like, hooray, now I get to go and do things that I wasn't able to do before, and I'll just go visit people, and you know, that sense of relief. I think it's important to allow that to happen, but people also have to double down with trying to do safe behaviors. Make sure you're masking, don't take unusual risks, don't start doing high risk activities. Do it for the sake of the kids, because we got to keep our rates down so our kids can be in those schools, so people feel comfortable that schools can be open. We know that schools can be open actually even under pretty high case rates as long as those mitigation strategies are in place, but it really helps to have everybody feel like the community rates are also low.
Thank you, Dr. Naomi. If I can stay here for a minute with you, I think there's a lot of confusion about this. There's a lot of mixed information. I won't say misinformation, I'll say mixed information. And so when I hear about the schools in Europe because of the new variants that they're closing down, and when I hear some members say that kids can't get COVID, right? Can you clear up some of those misconceptions or those myths? You know, what is that about?
Mm-hmm. I think that over the course of the pandemic, we've had lots and lots and lots and lots of different data. So I think it's really understandable that there is actually a lot of confusion, or sort of trying to figure out what is sort of the right answer in terms of, is it safe or is it not safe? And I would say that so there's the variant question, which is there's a variant in the United Kingdom that is more transmissible than the sort of original COVID strain. And so it's extremely important to be paying attention. Like, do we need to do anything differently if there's a new, more transmissible strain? And one thing to say about it is that it is more transmissible, but it's not a lot more transmissible. That's one piece. And the other piece is that children, they have an increase in transmission a little bit, the same way that adults have a little bit of an increase in transmission. So that's one thing. People are a little confused. Are the students all of a sudden is all of a sudden schools different? No, it's that the whole community is like a little bit more transmissible if that variant is in our community. In California right now, the rate of that variant is pretty low, actually, which is good. So the answer to that is we should actually make sure we keep on watching the data and they're doing testing to see, is that variant entering into our community? And then do we need to figure out, is it actually changing anything in terms of our understanding about how safe schools are? So that's one piece. The other piece is kids are less likely to get it, and they are less likely to have severe disease. And that has to do, just very briefly, that has to do with the fact that they make less of the doorway into the body for SARS-CoV-2, the virus that causes COVID-19. The doorway into the body is something called an ACE2 receptor. And kids, elementary age school kids, make less ACE2 receptors than middle and high schoolers do, and middle and high schoolers make less ACE2 receptors than adults do. And so that means they have less doorway into the body, so they just get less, they're less likely to get sick, and they don't get as severely sick if they do get it, which means they don't cough as much, which means that's part of the reason why they don't pass the disease as easily. But it doesn't mean that they can't get it. It just means that they're less likely. And so that's why also this, all those mitigation strategies are still going to be extremely important and very helpful in our schools.
Thank you for that. And I want to bring our other guest in on this as well. And Dr. Matthews, you mentioned this a little bit in your comments around wellness checks. And so previous to being at Tipping Point, I worked with young people who were transitioning out of foster care. And one of the things that we've always known when you work with kids who are in foster care is that bad economic times mean that the rate of abuse goes up. The last time that I looked at the data here is that even though we're in bad economic times, that the number of child abuse reports have gone down. And the theory around that is that they're gone down because, one of the things that I hope we all realize now is how critical schools are in our communities. And one of the reasons that they're theorizing that number has gone down is that it's not less abuse, but there are fewer people, like teachers, who have eyes on the kids who can actually spot that abuse. And so can you give me a little bit about what it is that you're doing, not just about abuse, but more, Dr. Matthews and Mayor and Dr. Naomi, about the wellness of families, because as we know, schools go well. I didn't really realize this before. They go well beyond just educating. That is where the majority of our low-income students get fed. It is where the majority of our low-income students after-school programs get childcare. And so can you tell me a little bit about what are some of the efforts we're doing to make sure that the whole family and that the whole kid as well during this pandemic?
So I started with the wellness checks that we're doing. We have our site staffs are checking in on families to make sure they have what their needs are. We have counselors and nurses and school site staff also calling our students and teachers, checking on them during class time. But as you said, and we know that we as a system, at least at this point, are much more effective with in-person than we are over distance. And we realize that, and we want to do everything we can to get back. I think a big part of that is coming back safe. We also are making sure that for our families, we're providing meals and giving assistance to links to other places where if families need even more food, where they can go. I think a third piece is, though, that we, as we're doing these wellness checks, are coming back. We also have a line established where people can phone in to let us know if we didn't hit something, or if the wellness check, if it's in between the wellness checks. It's a phone line that's 24/7. They have live during the day, during the weekdays, Monday through Friday. But if you call on the weekends or after that time, you'll get a call back immediately. So we're doing everything we can to check in. If you don't mind, I wanted to go back to one point that Dr. Bardach was saying about making sure that we're giving all the supports that sites need in order to get to a place where we're be able to bring students back safely. And, I have the opportunity to talk to superintendents both locally and throughout the nation. And we all went to school to be typically teachers first, and then administrators, and then many of us are now in these positions. And I truly think it's a blessing to be in this position. But one of the things that's really has been a difficulty is the fact that you talked about those supports. And for example, we started talking about, okay, we need to do surveillance testing. We talked about this back in September. And when we reached out to the state, I'm just being transparent, we didn't get the support that we would have wished for. So we had to become the experts in setting up testing centers. We had testing centers set up in our parking lot at 555 Franklin. We, as a district, had to set that up and make that happen. We had to go out and find a test, find those kits, set up the testing center, partner with local agencies, but we had to set that up. Now and as we're doing all of this, the sands under our feet are constantly shifting. We start working with our labor partners to figure out what it looks like, what safe looks like, and then there's a shift. So we start moving towards making progress, and we think we're going to get closer to returning, and then the standards change. So it goes from you don't have to have testing for students to now we want students tested every 2 weeks. We're just figuring out how to get our adults tested. So when I heard Dr. Bardach say, we want to make sure you have all the supplies you need or all the resources you need, we're figuring out how to do testing, how to do surveillance testing on adults, now trying to figure out how to do surveillance testing on students, and in the middle of SANS constantly shifting. So
and teaching algebra at the same time.
Absolutely. And all of this is happening. Absolutely.
That's crazy.
So I just wanted to be real about when you say we want to make sure that the supports are there. When I talk to my colleagues who are trying to run these systems, right now the supports aren't there. But even with that, we're still going through figuring it out. But we're asked the question, what support do you need? And we say, this is what we need. We just get blank stares. So I just wanted to be real about that.
Well, Mayor, anything you want to add to that, or?
I appreciate you making it real, because please know that your public servants have been working 2 full-time jobs since March. I think of my transportation policy director has actually been standing up testing sites in Oakland, which is clearly not part of his original job description. But I want to get back to, I think, where you started, Sam, which was kind of how are we taking care of our families in this moment and the totality. I know Oakland public schools are really committed to being full service community schools. And when I think about this opportunity, I think of resilience. We have to build stronger systems so that when these inevitable crises happen, right now it's a global pandemic, it could be an earthquake, it could be a wildfire, it could be anything these days. How have we created a stronger community that takes care of one another? In Oakland, I also have been really pleased with something called the Great Oakland Check-in. We got, just in a matter of social media posts, 600 volunteers to make wellness checks to people throughout Oakland, to connect them with resources they didn't know about, especially food. I mean, people going hungry. And then also, I am really passionate about the idea of guaranteed income. It's an idea that people were talking about before the pandemic, but it is so much more poignant right now. Because if we had had a system that was designed to ensure that everyone maintains an income floor, we would have been so much more able to quickly respond as people's incomes went away. And that is what is driving the stress, especially in this high cost area. So Oakland is very excited. We will be announcing very soon a very ambitious guaranteed income pilot that puts families at the center. So again, those are some of the silver lining opportunities where we can respond to this crisis in a way that makes us much more prepared the next time something comes along.
Thank you, Mayor. I want to make sure that Dr. Naomi has an opportunity to respond. Part of the blessings log, depending on what it is that you believe in, is that Dr. Naomi has been appointed as the lead of the school safe schools for all return. And so any comments you want to make around what else government can do, what else our leaders can do around the safe return to schools, or about my question around the full health of kids and families during this pandemic?
I could say a lot about both of those things, actually. So I'll start actually just briefly with a note about the full health of kids and of families, which I think is extraordinarily important. And I actually think it's the full health of teachers also. We talk a lot and we focus a lot and we report a lot with all of our dashboards about the direct health effects of COVID-19. And the things that we are not tracking are the extraordinarily deep indirect health effects and of COVID-19, many of which are mediated through school closures, and that's mental health effects on children. It's the child abuse that it's under. We do think that that the evidence is probably showing that it's underreported, in part because teachers don't have eyes on kids. Hunger, all these things. And there's a recent article from the New York Times about the mental health effects on kids. We are not measuring it. And there's, higher rates of suicidality that people are worried about, in particular adolescents. So I think that as much as we can, we actually need to continue to be measuring those things. And there's that report that just came out, a PACE report that just came out 2 days ago about the educational effects, and that we also know just direct increased risks of educational failure. So extraordinarily important for us to keep our eye on those metrics as well. Because it's so easy for us just to look at COVID numbers and to sort of not notice or discount in our policy decision making and in our resource allocation to those other really important metrics. And so that's actually why I think this emphasis on school reopening for in-person instruction is so extraordinarily important, because it does really try to address all those things that are going unmeasured that are extraordinarily harmful to our communities. So that's one piece. The other piece about resources for schools, the testing, I'm deeply empathetic, because before I went up to the state, I actually worked in San Francisco DPH trying to figure out, I was actually, lead of the testing strategy group to try and figure out, what are we going to do about testing? And so I am very much aware that it is a big struggle. And I know that the state at the time, in September, October, I think even November, actually, the state was not able to actually provide a whole lot of support. When I got to the state in early December, they actually have done an incredible job of standing up testing in the Valencia branch lab, which is the state-sponsored lab with PCR tests that are half the price of the current, commercial rate. They also will do the insurance reimbursement for schools on the back end. They're specifically focused on schools, and they're doing a lot of innovative things to help support both the student testing and the staff testing. And it's things like right now trying to validate a collection method for teachers. They can do it at home instead of having to come in and do it anywhere. That saves a ton of effort for the teachers. They don't have to go anywhere, and also it helps the schools not have to figure out, how do we staff up, how do we put the people in the parking lot, right? I totally get that. And then the other piece is also focusing on the student testing. How can we do it in a way that's actually pretty efficient and pretty easy? The image that many people get when they think about student testing is, an adult with PPE, personal protective gear, a mask and a face shield and a gown and gloves, and, putting this long stick in a kid's nose way in the back. That does feel totally impossible. Of how are you going to get a kid? How are you going to get a bunch of kids to do this? How are you going to get them to do it again and again? So there's alternative ways of doing it that have been, scientifically validated, that the kids can actually hold the stick themselves, and they can just do front of the nose testing, so you don't have to go all the way back. And the Valencia lab and the state is helping to put out training materials. How do you do that? How do you do it efficiently? You can do a group of kids at once because you don't have to do one at a time. The kids are hilarious. There's a great video that they put up that they put together that is going to go up very shortly, I think, on the website, which basically shows all these kids doing themselves. And I joke, because I'm a pediatrician, that it's like picking your nose with a Q-tip. And kids, even as young as kindergarten, can actually do it quite well. So just to help reassure you, like COVID is constantly changing. And so it feels like government is constantly moving the goalposts, but it's actually because COVID is constantly changing. And so the increase in testing is the one thing that we haven't really maximized yet in all of our interventions for COVID-19. So we're trying, people they've heard masking, physical distancing, hand hygiene, ventilation, max all of those things, optimize them. The testing is the piece we haven't really maximized yet. And as we continue to talk to all the different members of the school communities, and Dr. Matthews mentioned the unions, testing is another layer that they have historically actually really felt like is an important piece. And so as much as we can help support people to feel like it's safe, that will, the goal is to smooth the pathway. And then two other last points is that the new guidance, just to clarify, because I know there are educators on the phone, in the audience, is to say, the guidance says the level of testing in that guidance is what is supported by the state, meaning that we have the resources available to schools to do it, but it's not a requirement. So I know that it can come off as feeling overwhelming if it feels like a requirement. You have to do this, but it's just that it's what is supported by the state. And then the last thing to say is that it's also the way the federal government is moving. And so as we also talk to national leaders, as Dr. Matthews says, California's big, they want it tends to be, we have national conversations as well as state level conversations. That's where the puck is moving. I've even heard some people talk about it weekly. There's a Rockefeller report that Rockefeller Foundation does some consulting and sort of supports the thinking at the federal level. And there's a report that says weekly student and teacher testing for everybody all the time. So in some ways, our what we can support is actually trying to move towards that without saying this is what anybody would expect at this point, given what we have of testing technology and testing capacity.
And so I'm going to tee up what may be the last question. Maybe it's the next to the last question. And so that question really is, part of it is also as I've been sitting here, right? I've been getting text messages from other philanthropists. I've gotten text messages from companies who are located here in the Bay Area that say, Sam, I can help with that. Right? If you need to roll out, I always get these conversations like, if you need to roll out vaccines faster, I can help with that. If you need to set up interim kind of living situations for your homeless population, we can help with that. And so the question that I have, maybe the next to the last question, is how can philanthropy and how can companies in the Bay Area who are always reaching out, saying we can help with that, what is it that they can do? What is it that you need help with? How can we help? How can we support you as we move toward reopening our schools? And once they're reopening, helping kids catch up. So I'll start here with the mayor, and how can we help?
Oh, we need you now more than ever. More than ever. And I'll say, like, right now, my most urgent ask is, I said we have 97% of our kids with that digital divide starting to be closed. We've got to get those other 3%. They are the most vulnerable 3%. So please, if anyone could invest anything, I would say give to Oakland Undivided. And I want to say that this is not the moment. I know people are frustrated with government. Naomi, I think, made a really good point. But Oakland Undivided has been very intentional that we have a 3-year plan to close the digital divide for good, but to not do it with a long-term reliance on philanthropy. We have an advocacy path. We have a legislative path where we believe we can permanently close this through having it scaled and institutionalized within our public systems. So I know people are frustrated with government right now, but if you step back, this moment has taught us that government, and frankly, our American democracy, has never been more important. But Oakland Undivided and the partnership that we have with philanthropy gives us the tools to act quickly, to gather the evidence and show the case to actually transform public systems, and that systemic change, that is the big win. The other things that are really high on my list is that, Oakland Teachers Rooted, the teacher affordability pilot. We have a few, just like 1 month to actually secure some more funding so that we can actually grow the next class of our teacher residents. So that's a very high and urgent priority for me. And finally, the Oakland Promise. That is our Cradle to Career initiative that is struggling right now to keep our kids with their eye on the prize of that college degree. There is so much competing with that right now. And to support our children in the context of their families and their community, to actually finish high school college ready, to get into college and to stay in college till they get that degree. That is urgent work right now. So Sam, those are my top 3 priorities. And I again say the only way that we can change the world is through public-private partnerships.
Thank you, Mayor. Dr. Matthews?
Thank you. I would, a couple of ways. First, I want to appreciate the mayor in speaking on the arm, the foundation arm. And I know our community, our deputy superintendent of community funding would kill me if I didn't mention and say that. So our arm it's called Spark SF. And the goals of Spark SF are really to make sure that our students graduate with those 21st century skills so that they can be successful. And there are a number of initiatives. Those initiatives haven't stopped because of the pandemic. We are still doing everything we can to make sure our students have those skills. So one way is definitely to go to our Spark SF website, and you will see exactly what those initiatives are and what we're trying to do for our students. So that's one. I'd say the other is we are partnering. We just had a press conference a week ago with one of our supervisors, Hillary Ronan, with all of our board members, our school board members, are all working towards now looking at, you talked about pivoting, Sam, and it's really about pivoting towards, because we know we're going to come out of this pandemic, and what does the learning loss look like? And how do we make sure that we're closing that gap to make sure that we're getting students caught up and even going past where they were. And a big part of that is we're going to need assistance with that. For us, it really is, this has been a constant pivot, a pivot from going into distance learning to accelerating distance learning and making it better, to starting to work towards the path of returning to in-person learning. And in each of those ways, we are going to need the assistance of our community standing side by side with us. We aren't in this alone. We know we're all in this boat together, and we're going to have to work together to get back to a place, not only back to a place, but to a better place. We don't want to return to what we had before, because what we had before wasn't working. It definitely wasn't working for all kids. So how are we going to make sure that we learn from this, learn all that we can, and return to a better place?
So I want to tee us up for the last question. And, one of the things that my team didn't let me know is that people can still text me. So they're bypassing the official channels for question. And one of the texts I've gotten is from the lady I call my second mother, Carolyn Bolton. And yes, Carolyn, I'm shouting you out on TV. And I will get to you and answer your question myself. But I also want to just say that I'm really proud of the way that the Tipping Point community has stepped up, because we have provided funding during COVID for a lot of the things that you're talking about. And so we provided funding to John Burden Advocates for Youth, for computers specifically for young people who are transitioning out of foster care and the foster care system. We've also provided funding to make sure that kids, as well as their families, are continuing to get fed during this pandemic. And I've mentioned earlier rental assistance and prevention, as well as in San Francisco, the learning hubs that Department of Children, Youth, and Family in I think maybe about 120 or so nonprofits have set up to reduce the learning slide. But there is in the last 5 minutes we have, I want to go to the last video that we have, because I think it is a perfect way to end. And this is a video from, she's going to reference San Francisco here, but this could be a parent anywhere in the Bay Area region. And so if we can pivot to that last video really quickly as we close, and take some quick comments from our panelists on this parent's question.
Hi, my name is Amy Latterman. I'm a San Francisco resident and mom of 3 kids in the public school system. I also have a long history of working in the education space here, both professionally and as a volunteer. I'm worried that many families and parents have lost faith in our public school system during the pandemic. I ask the panelists, how can our community recover from this blow and rebuild confidence in public education here in San Francisco?
And again, I want to amend that and not have it just about San Francisco, but how can we build public confidence again? Can we start with Dr. Naomi for the last few words on this, and I will try to get to the other panelists as well.
I think that's a complicated question, and it may be beyond my purview for public health, but I will say it's one of the things I do worry about in thinking about discussions with the teachers union. I actually am worried about the health of public education in the long run, and what that means for teacher health and teacher economic stability in the long run. And so that to me, we know that financial stability is a social determinant of health. So that is my public health hat on, actually worrying about that. And I do think getting the schools reopened for in-person instruction as much as possible, as long as it's safe and people feel confident in that, which I do think is really possible when we have all those mitigation strategies. I think that's actually one of the pathways forward. And I'm happy to keep on helping people think about that and how to operationalize that.
Okay. Dr. Matthews.
Yes, so that's a great question, and I appreciate that. I'm definitely getting emails regularly on that question. And I think a big part of this is transparency. I think it comes through transparency of us making sure you know everything that we're doing as quickly as we're doing it. And I would agree that the quicker that we can get to a safe in-person learning, which actually is what I've heard people say that they don't think that's the goal, or they think it's taking too long, or I understand all of that. But I also think that through transparency and making sure you're aware of what we're doing, that we're putting it out in every way that we possibly can, both on our website, through pushing it out to you through our Wednesday digest, making sure that you know what we're doing, how we're doing it, where we're having snags or setbacks. I think that's how you build trust in the system. It's just being totally honest with you about where it's working and where it's not. And we started with how complex this issue is, this problem is, and it really is. It has so many layers, so many levels. But a big part of building confidence is having honest conversations with each other.
Thank you.
Amy, that was a great question. And I always say I'm so proud to be the mayor of Oakland, a native of Oakland, and I am a public school parent and public school graduate of Oakland. This is not the time to abandon our public institutions. We need your wisdom, your involvement, your activism more than ever. I'm proud to be an Oaklander because this city cares about equity, about justice, about fairness. And isn't that what we're trying to teach our children in this moment as well? And if people abandon the public system, they are abandoning that value. And so I really want to lift up and commend parents like Amy and like a lot of parents in Oakland. There's a new organization, openschoolsca.org, where parents across the state are starting to collaborate and talk about what transparency and participation means in our public school system because of this pandemic. But I believe that that new involvement and demand for transparency will make all our public systems better, not just during COVID, but forever. As one new president said, let us build back better.
Well, thank you. I want to thank the guest once again for joining me today. I want to thank once again McClimate's principal and staff. Go Warriors. McClimate's Warriors. I also want to thank my staff for helping put this on, and of course the Tipping Point community of grantees, donors, and stakeholders who are all in this to build a better Bay Area. And once again, thank you. And as I started, something I learned from Carolyn, we're going to love on you and support you, but I promise we will also hold you accountable. Thank you for your time today, and thank you to you all for joining us. Thank you.